Hello, I'm Dr. Maurie Markman from the University of Texas MD Anderson Cancer Center in Houston, Texas, and I wanted to briefly discuss a very interesting paper that recently appeared in the November 10th, 2008 issue of the Journal of Clinical Oncology entitled Cardiac Toxicity of Sunitinib and Sorafenib in Patients with Metastatic Renal Cell Carcinoma. What this report is of a group of patients receiving either of these medications at a single center, or a total of 86 patients. And what the investigators noted that 34% of the patients, the eligible patients, actually experienced a cardiac event, and 41% of the patients had EKG changes, and 18% of the group had symptomatic cardiac problems receiving the therapy. Clearly what this study suggests is that the incidence of cardiac events associated with these medications is quite significant. However, perhaps the most important part of the paper was not merely the fact that cardiac toxicity was common, but that in fact it was able to be managed in essentially all of the patients, and the patients, even though they had these cardiac events, were able to be continued on treatment with the medication, and that there was no statistically significant difference in outcome in those patients who had a cardiac event versus those who did not experience such an episode. So I think the important part of this paper is, one, cardiac toxicity is common with these medications, and two, if recognized early, these episodes can be managed well, successfully, and patients can continue to receive these medications that clearly have been shown to have a favorable impact on the course of the illness. I would encourage you to read this very interesting paper, which again appeared in the November 10th issue of the Journal of Clinical Oncology. Thank you for your attention.